Welcome back to the Victory Education Lounge. I'm your host Maurice, and today we're exploring Beyond the Blood Sickle Cell's Full Body Effects, Part 6. Before we dive into this eye-opening journey, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more people with this vital information. When we think of sickle cell disease, we often focus on its effects on blood cells. But the reality is far more complex. Sickle cell disease is like a domino effect, where the initial change in blood cells triggers a cascade of consequences throughout the entire body. Today, we'll explore how this blood disorder reaches far beyond the circulatory system, affecting nearly every organ and tissue. Have you ever wondered if sickle cell disease affects more than just the blood? If you have, you're not alone. This complex and often misunderstood disease is frequently associated solely with the circulatory system. However, sickle cell disease is akin to a ripple effect, where a singular change in the shape of blood cells triggers a cascade of consequences throughout the entire body. It's a condition that reaches far beyond the veins and arteries, touching nearly every organ and tissue, from the brain and eyes to the kidneys and skin. It's a disease that doesn't discriminate, impacting both the young and old, men and women alike. It's a reality that many individuals live with every day. So join us as we embark on this enlightening exploration of the full body effects of sickle cell disease. Let's take a deep dive into the all-encompassing impact of this blood disorder on the human body. Sickle cell disease can be compared to a domino effect. The initial change in blood cells triggers a cascade of consequences that reach far beyond the circulatory system, impacting almost every organ and tissue in the body. Let's delve deeper into these full body effects. Firstly, the brain. Sickle cells can obstruct blood flow in the brain, leading to strokes even in young children. The resulting damage can cause cognitive impairments, learning difficulties, and physical disabilities. Then the eyes. The retina, the tissue at the back of the eye that's sensitive to light, can be damaged due to poor blood flow. This can result in potential vision loss. The lungs are not spared either. Sickled cells can get trapped in the small blood vessels of the lungs, causing a life-threatening condition known as acute chest syndrome. The heart also feels the strain. Increased workload to pump blood through partially blocked vessels can lead to an enlarged heart and, over time, heart failure. The liver can suffer chronic damage due to the breakdown of sickled cells and iron overload from frequent blood transfusions. The spleen often becomes damaged and non-functional in early childhood, which increases the risk of severe infections. The kidneys too can be affected. Sickle cells can damage their ability to concentrate urine and filter blood, which could potentially lead to kidney failure. Bones and joints are also at risk. Poor blood flow can cause bone tissue to die, leading to joint problems and severe pain. The skin can suffer as well. Poor circulation can lead to leg ulcers that are slow to heal. Lastly, the reproductive system. Men may experience painful, prolonged erections, a condition known as priapism. Women, on the other hand, may face complications during pregnancy. As we've seen, the effects of sickle cell disease are not limited to the blood. It's a disease that affects the entire body, from the brain to the bones, from the heart to the skin. It's a disease that doesn't discriminate between organs, tissues, or systems. It's a disease that, once it starts, can set off a cascade of effects that can be both devastating and life-altering. But remember, knowledge is power. The more we understand about sickle cell disease, the better equipped we are to manage it, to treat it, and to support those who are living with it. So let's continue to learn, to explore, and to strive for a future where sickle cell disease is no longer a sentence, but a condition that can be effectively managed. As you can see, the effects of sickle cell disease reach far beyond the blood. Now let's bring these effects to life with some real-world scenarios. Picture 10-year-old Sarah, a lively and intelligent young girl. One day she suddenly has difficulty speaking and moving her right arm. Worried, her parents rush her to the hospital, where an MRI reveals she's had a silent stroke due to sickle cell disease. Although she's just a child, the disease has already started affecting her brain, leading to cognitive impairments and physical disabilities. Then we have Marcus, a 25-year-old aspiring musician. He wakes up one day with a fever and intense chest pain. He's quickly diagnosed with acute chest syndrome, a potentially life-threatening lung complication of sickle cell disease. His dreams of playing at concerts are suddenly cast into doubt as he struggles to breathe. Next, meet Aisha, a 30-year-old book editor who loves to read. She starts noticing dark spots in her vision, an eye exam reveals retinopathy caused by sickle cell disease affecting the blood vessels in her eyes. The disease has now threatened her passion for reading and her career. Our next scenario involves Jamal, a 40-year-old father of two. He wakes up one morning with severe hip pain. X-rays show a vascular necrosis, where part of his hip bone has died due to poor blood flow caused by sickle cell disease. The disease now affects his mobility, making it hard for him to play with his kids. Lastly, consider Zoe, a 35-year-old fitness enthusiast. During a routine checkup, it's found she has protein in her urine. Further tests reveal early signs of kidney damage due to sickle cell disease. Her fitness goals are now challenged as she navigates the early stages of kidney disease. These are not just hypothetical scenarios, but real-life situations that people living with sickle cell disease face every day. Sarah, Marcus, Aisha, Jamal, and Zoe's stories illustrate how sickle cell disease can affect multiple organ systems, often in unexpected ways. From cognitive impairments in children to vision loss, lung complications, joint problems, and kidney damage, the impact of sickle cell disease reaches far beyond the blood. It's a domino effect that can touch nearly every organ and tissue, causing a cascade of consequences that can significantly affect a person's quality of life. But remember, while these scenarios may sound daunting, they're not a certainty for everyone with sickle cell disease. Each person's journey with this disease is unique, and advances in medical science are continually providing new ways to manage and treat these complications. So, as we continue our exploration of sickle cell disease, let's keep in mind the multi-system impact it can have. But also remember the resilience of those living with the disease, their strength in the face of adversity, and the hope offered by ongoing research and medical advances. These examples underscore the multi-system impact of sickle cell disease. Given these wide-ranging effects, how can we manage and prevent complications related to sickle cell disease? It's a question that has prompted significant research and development of various strategies. Firstly, there are comprehensive care centers. These specialized clinics offer a coordinated approach with multiple specialists addressing the different aspects of sickle cell disease. The benefits? Holistic care, improved management of complications, and tailored treatment plans. However, the downside is that these centers may not be easily accessible for all patients, especially those in remote areas. Secondly, we have medications and therapies. Hydroxyurea, for example, is a drug that can reduce the frequency of painful crises and the need for blood transfusions. Moreover, blood transfusions themselves can be beneficial in managing certain complications. But these treatments come with their own side effects and risks, such as drug toxicity and iron overload. Then there are bone marrow transplants, currently the only potential cure for sickle cell disease. They offer hope for a disease-free life, but the process is complex, risky, and finding a suitable donor can be challenging. Not to mention, it's an expensive procedure that may not be covered by all insurance plans. In terms of prevention, newborn screening is a crucial strategy. It allows for early diagnosis and initiation of treatment, which can significantly improve the child's quality of life. However, it requires a well-established healthcare system, which might not be present in all countries. Lastly, we have education and counseling. Educating patients, families, and healthcare providers about sickle cell disease can enhance understanding, improve management, and reduce stigma. Genetic counseling in particular can help prospective parents understand the risks of passing on the disease to their children. However, the effectiveness of these strategies depends heavily on the quality and reach of the education and counseling programs. In summary, managing and preventing complications of sickle cell disease requires a multifaceted approach. Each strategy has its own strengths and weaknesses, and what works best may vary from patient to patient. Therefore, it's essential for healthcare providers to work closely with patients and their families to develop an individualized management plan. Remember, sickle cell disease is not just a blood disorder. It's a full-body condition that requires a full-body response, and with the right strategies in place, we can mitigate the full-body effects of sickle cell disease. We've covered a lot of ground today, haven't we? From the brain to the bones, we've seen how sickle cell disease impacts the entire body, often in ways we wouldn't expect. We've also learned that comprehensive care is crucial in managing this complex condition. Thank you for joining us today. Remember, knowledge is power, so share this video, subscribe to our channel, and help us spread the word about the full-body effects of sickle cell disease. Before we wrap up, a quick disclaimer. The information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decision should be discussed with a licensed physician or qualified healthcare professional, especially if you have existing health conditions or are taking medications. Thank you for joining us in the Victory Education Lounge. Don't forget to like, subscribe, and share your thoughts below. Your engagement helps us create more valuable content and reach those who need this information. Until next time, this is Maurice, reminding you that understanding the full-body effects of sickle cell disease is crucial in the fight for better care and ultimately, a cure.